So a lot is being talked about this concept of home healthcare. What exactly are you doing, and is it different from what regular, like how different is it from the conventional healthcare? And what gaps do you identify in that as well? In both, I would say, home as well
Absolutely.
as conventional. Yeah.
Yeah, a conventional, traditional home healthcare organization, the way they operate, the way they work is that a patient comes out of the hospital, a patient is in the hospital bed, and they say, and the physician comes to the hospital bed and says, you could go home, but you need supervision, and you don't qualify for a skilled nursing facility, but you could go home, but you need some sort of supervision to help you get back on track. And so that's where home health would come in. So that physician will tell the patient, you could go home with the home healthcare organization. It's short-term rehabilitation in 60 days or less or more. Our goal is for you to leave the hospital and get back to what you do in the comfort of your own home, as opposed to going to a facility. And that's the best place to recover is at home. So that's the traditional conventional model. What we do as an organization, we hit a home run with the traditional model. We work with the hospitals, we work with the clinics. We also work with health plans, the insurance companies, and we help them identify gaps, and through the insights our clinicians are identifying inside the patient's homes, and help them find opportunities to close the financial gap, improve their quality, and at the same time improve the health of the patient. And it's a win-win for the patient. It's a win for us. It's a win for the health plan, but it's a win-win for the patient because they win twice.
Yeah, how is thanks for explaining that, but I would just like to understand on the patient adoption part of it, like how easily is it for a patient to adopt it, and what's the landscape like? Is it growing, or is it like how is it in Chicago, or do you plan to expand? But right now, how do you see the patient acceptance landscape in this?
Yeah. So it's that's a great question. Oftentimes it's people identify home health care as a choice in their most vulnerable state. So they're in a hospital bed or they're in a medical office and with a primary care physician and they need to get better. Otherwise, they're going to start going to another level of a deeper state of their diagnosis. And that's where they need some sort of intervention. So people are able to access home health care when they're in a position of vulnerability. And most people are not using home health proactively. We do
That's
get,
where I came from, because even though it appears to be like something that needs to be there, I don't see that acceptance like that much evolve. I think there's a lot of untapped potential in that. What do you think?
I agree. And one of the things that we learned one thing we've learned throughout our journey in the past since 2012 is that people are not playing to lose anymore. People
Right.
are playing to win. That's a difference. And when I mean by playing not to lose, it means that there's a concept called aging in place, and that's preventing a person from getting worse. And that's where our clinicians are very intelligent. We work collaboratively with the clinicians to identify these insights. People are the way our the healthcare environment is utilizing us is exactly precisely what you said, Mr. Anirudh, is that to help people not get worse. But we're seeing a discrepancy between what the industry is saying and what the way we're being used and the way patients are starting to evolve. After the pandemic, we're seeing more and more people playing to win, and that they want to add more years to their life and life to their years. And they're being more proactive to their health plan, more invested in themselves as opposed to being reactive. That's something that we're seeing, and that's something that we're training our clinicians on.
And what are the cost implications for the patients? You did mention insurances are covered, but how is that getting? How can a patient get the best benefit of it, this service?
Absolutely. That's a great question, Shannon. The next, this is the inside joke of, not inside joke, but in a little bit of an insight of what we say in the industry is the next blockbuster drug. The next blockbuster drug isn't GLP-6 or another thing that I can't really remember right now, Ozempic or whatnot. The next blockbuster drug is patient engagement. Patient engagement is the blockbuster drug that we're all waiting for. And there's no magic silver bullet that can do it. No Merck or Johnson Johnson can make that or manufacture that. And everyone's a bit different. That's where our clinicians will come in. We'll work with the patient, we'll help coach them, we'll understand what their goals come from their environment and help them achieve those goals and help them get back to where they need to be. And that's one of the core fundamental principles. And we do it better than anyone else in the marketplace. And it shows because of the way people utilize our services and ask for us at the point of care, the point of contact. And yeah, and so that's how most organizations and most individuals are utilizing our home healthcare services.
Absolutely. That's where I was coming to.